Hello and welcome. My name is Meg Landis with Project Hope, and I'm honored to be sitting here with Project Hope's President and CEO, Rabih Torbay, and Deputy Chief Health Officer, Dr. Uche Ralph-Opara, to chat about humanitarianism and what that really means to them. Both Rabih and Uche have decades of experience working in the health and humanitarian sectors, spanning across continents and helping countless communities. I am speaking with Rabih and Uche in celebration of World Humanitarian Day, a day of celebrating humanitarian aid workers that started 20 years ago by the United Nations. So thank you both so much for joining me. I'm really excited to chat with you both. And to start off, what does humanitarianism look like to you? Uche, I can talk to you first.
Okay, thanks, Meg. So to me, I would say humanitarianism means a commitment to alleviating human suffering and promoting well-being. So that's more generally speaking, right? Through provision of aid or interventions that are more importantly equitable and timely, to vulnerable populations. So regardless of where they are geographically located or regardless of, the social political situations. So that's what humanitarianism means to me.
Thank you. And Rabih?
Meg, it's good to be with you. And I agree with Dr. Uche. I mean, it's really about alleviating suffering and improving people's lives. But for me, it's also about taking action to make the world a better place. That's what it comes down to. It's about caring and doing something to make the world a better place. We see a lot of talk about we want to help, but if you don't take action, you're really not doing something. So for me, humanitarianism is equal to action.
Thank you. This next question is for you, Rabih. You've had many, many years, not to age you, but many years working in the humanitarian sector. Could you share a moment in your career where it clicked that what you're doing is working to save lives?
Meg, I've been doing this work for almost 25 years now, even though that's not my field of studies. But I'll go back to where actually it all started for me, where I decided to actually become a humanitarian. And it was in 1999 in Sierra Leone. It was during the Civil War, and there was a massive cholera outbreak on an island, on an isolated island, where about 100, 120 people were dying every single day. I managed to get a couple of volunteers. We bought some medical supplies and went to the island to see what could be done to help. And with the will of the volunteers and the community that we're working with, and a really very focused intervention, within a couple of days, we managed to get the death rate to 2 people instead of 100 or 120 a day. And within a week, there were no more deaths. And for me, I looked at it as, if you can actually focus your intervention and know what you're doing with a very limited investment, you can make a huge difference in people's lives and save lives. And for me, that was the changing moment. This is when I decided to actually leave my engineering work, which is something I've done for a while as well, and really focusing on doing humanitarian work. And it's those moments that actually impact you for the rest of your lives. I've been doing it for 25 years because of that particular moment.
That's amazing. That's a great story. Thank you. As I mentioned, it is the 20-year anniversary of World Humanitarian Day. That is a huge feat. And what are some of your favorite moments? This is for both of you. What are some of your favorite moments of humanitarianism in the past 2 decades? Rabih, do you want to go first?
I mean, that's a tough question because, I've had so many of those moments. It's just amazing what doing this work can do for you. We always focus on what we're doing for others, but this work actually does a lot for us ourselves. And for me, it's just coming together for a common cause, coming together to make an impact in people's lives. When I visit places like Ethiopia or Ukraine, and you see the impact of our work there, and you see that on the faces of people, the appreciation that somebody's actually there who cares about them, and not me. I'm talking about the health workers and others that are out there. That makes a huge difference. For me, that's humanitarianism. But also going back and seeing the difference that we've made in people's lives, that our health workers, our humanitarian workers have made in people's lives. Those are some of my favorite moments when you see a malnourished child, and you go a month and a half later, and you see that child playing in the playground, healthy. Or when you see a pregnant woman who's been struggling with her pregnancy, and suddenly you see her with a baby, and both of them are striving. For me, those are the moments that we live for. Those are the moments that make our work really meaningful.
Thank you. And what are you hopeful for the next 2 decades too?
I mean, the first thing that I'm hopeful for is really less humanitarian needs. We're seeing the humanitarian needs increase day after day after day, and getting more complex. So for me, it's really less humanitarian needs. But at the same time, we know that that's not going to happen without an increase in diplomacy to reduce the tensions, to reduce some of the conflicts that we're seeing. Tackling the climate crisis, we can no longer ignore it. We can no longer ignore the impact of the climate crisis on health, on humanitarian world, on people's lives every day. And really a collective effort, a collaborative collective effort between all the different organizations, the international community, most importantly, partnering with the local communities and the local authorities to make a difference. That's what I'm hopeful for, that we can actually all come together and focus on what's important and try to tackle some of those challenges, especially, again, the climate crisis and the conflicts that are happening more and more every day, and they're getting more complex, and more people are suffering. And the one thing as well that I would have to say is that in the next 2 decades, I really hope that we tackle the shortage in the healthcare workers globally. We've seen it here in the US, but it's a global crisis that we do need to tackle if we really want to make a difference.
Thank you. And Dr. Uche, you come from more of the health sector, but humanitarianism is all around. Can you give an example of one of your favorite moments of humanitarianism and in the past 2 decades, and also what you would want to see in the future for the next 2 decades?
Yeah, thanks a lot, Meg. And I really align with Rabih as well on his points. But like you mentioned, coming from the global health and development perspective, some notable moments I would like to highlight would be the 2014 Ebola crisis in West Africa, which pretty much showcased how international collaboration could be helpful with addressing outbreaks, right? We saw a lot of coordinated efforts, to control the infectious disease spreading. And very importantly, we saw a lot around health system strengthening from that situation. And even more recently, the COVID-19 pandemic, where we saw a very, really, really very swift global effort to develop vaccines, to distribute medical supplies, PPEs, and also support very fragile health systems globally. So this, again, highlights the importance of global solidarity or movement, when we have health crises like this. So just to add on to what Rabih said and speaking more to the global health perspective, in the next 2 decades, what am I hopeful for? So 2 things. One would be around a continued technological innovation, right? To revolutionize how we respond to humanitarian needs. So things like strengthening our early warning systems, and also in terms of disease surveillance, using technology to improve, disease surveillance mechanism, which we already have in place, right? And then secondly, health equity. Health equity is a big deal, right, in whatever programs we're implementing. So whether it's from the emergency response or humanitarian side, or from the global health perspective. So we want to see situations where we advance in health equity in terms of addressing the health disparities, because whether we like it or not, these disparities do exist, and we need to ensure that there's access, to healthcare for all, regardless of geography, regardless of socioeconomic status, and all of that. So yeah, that's my take on that piece.
Thank you. Rabih, you mentioned that there's a shortage in healthcare workers, and we're definitely seeing that in the news. What more do you think can be done to protect humanitarian aid workers around the world and healthcare workers?
Meg, I mean, you've been seeing in the news and hearing in reports the multiple attacks that are taking place on health workers, humanitarian workers across the globe, whether it's in Ukraine or in Sudan or other places. And this is a trend that's continuing, but unfortunately it's increasing. We're seeing this happening more and more. I mean, there are a few things that we could do, but I'll focus on two things. The first one is we really, I mean, the international community needs to hold the perpetrators accountable. They cannot continue to act with impunity. This is what's been happening over the years, and that's why it continues to increase, because people are not being held accountable. And it's not enough to issue a statement or condemning an attack. We need action. We need somebody to be held accountable, and we need action, not just statement. We don't need more sympathy. We just need somebody to do something about it, because we're seeing it every day. Attacks on hospitals, attacks on medical convoys, attacks on humanitarian workers that are there risking their lives to help others. The second thing is we need an increased investment in organizations like Project Hope and others, so we can build systems and train our people and give them the equipment that they need to perform the job safer. For me, those are the two main things that we really need to focus on. But again, really holding the perpetrators accountable, because this is not acceptable. When people attack a hospital and they kill a doctor or a nurse, I mean, they're not just killing a doctor and nurse, they're killing future generations that that doctor and nurse could have helped. And they're getting away with it.
It is very hard to see. You also mentioned earlier, you kind of touched on complex crises. We have been witnessing more and more complex humanitarian crises in the past few years. Could you speak on what a complex crisis entails?
I mean, a complex crisis is when there are multiple factors that lay one on top of the other, right? Conflict plus a pandemic, or a natural disaster and conflict and a pandemic. So there are different multiple crises that happen in the same place at the same time. And responding to those complex crises is really complex. That's why they call it a complex crisis. And it takes a lot of planning and effort, from selecting the teams that we want to send there, understanding what could be done and what couldn't be done, what could be done safely, because a lot of times in complex emergencies, safety and security is an issue. But also understanding our limitations, what it is that we can and cannot do, and working collaboratively with other organizations to make sure that we actually satisfy the layered needs that we meet. We're seeing that more and more. Again, whether it's Ukraine or Sudan or Ethiopia or Haiti, we're seeing a complete collapse of government, earthquakes, cholera outbreaks, you name it. All of them are happening to the same population at the same time, and that really makes the suffering more dire and longer. It's a prolonged suffering. It's not like a natural disaster where it's a shock, you're dealing with it. It's something that keeps happening. And for us, we need to plan for the long term in terms of how we deal with that complex humanitarian situation, and how can we make sure that we build resilience within the communities where we work in, the communities that we're serving and partnering with. So, that approach, that comprehensive approach, is something that is critical in any complex emergency.
I don't know, Uche, if you have anything to add to it. It is a huge undertaking.
Yes, so I want to agree with Rabih, and it's looking at it and acknowledging that humanitarian development nexus, which we find ourselves in, when we have complex crises, the long-term perspective. So you're just not looking at the immediate, humanitarian response needs, but you're looking at, the longer-term development efforts that need to go in, because we have to deal with the health system issues, we have to deal with issues of conflict, which would have led to displacement and health crisis, and then outbreaks, and then all of that. So it's looking at it more at the longer term. So immediately we've had those initial responses. What do we do to build resilient systems, going forward? Just looking at the recovery as well as part of that continuum of care. So I want to agree with Rabih's points as well.
And the layers, I mean, it's not just health equity and systems, it's mental health, it's physical health, it's everything. It's a very big topic.
Absolutely.
Uche, I have one of my final questions. Because of this ever-evolving technology that we're going through and this growing knowledge with social media around the world, we are seeing a lot of acts of heroism. Do you think anyone can be a humanitarian?
Oh, absolutely. I think anyone and everyone, can be a humanitarian. So regardless of your skills, your knowledge, your background, I believe, once you have that deeply rooted desire to alleviate human suffering, you definitely can be, a humanitarian. So while we have, traditional organizations and experts, that play that very crucial role in, humanitarian response, we also need to acknowledge that you have individuals and communities who are, demonstrating acts of heroism, in their day-to-day activities. Now, speaking of technology, which you mentioned, we've seen how modern technology like, social media, crowdfunding platforms, and also instant communication has, supported humanitarian causes. So from the very simple acts of kindness from individuals and communities, to the bigger global campaigns, we're seeing the impact and the positive changes, this has brought, over time. So for me, whether you're volunteering your time, or you're, sharing your knowledge, or you're donating resources, or you're raising awareness in your little corner, right? All of these collective efforts would certainly create that positive and lasting impact that, we want to see in a humanitarian response.
Thank you. Is there anything else that either of you would want to talk about or mention for World Humanitarian Day? There's so much going on with it, but it's a global effort for everyone to become a humanitarian.
Meg, just to add to what Uche said, which is something I fully agree with, everybody can be a humanitarian as long as we're not bystanders.
Mhm.
We need to do something, whether we spread the word, or we donate, or we participate, or we volunteer. Everybody needs to do something. The only people that actually can cause harm to any humanitarian mission are the bystanders who really don't care. And I do believe that we live in a world where a lot of people care. And if you're listening to this, that means you do care. So everybody can be a humanitarian. The most important thing is just do something. Whatever it is within your means that you can do, you'll make a difference. There's a complex world out there. There's a lot of bad things happening, but also there are a lot of good things happening. The communities that we serve, they're the biggest humanitarians. We go out there and they're the first responders. They're the ones helping each other, helping their own community. And all it takes is for us to care and do something to help them. And that could be, a first responder. It could be one of our donors. It could be somebody who's hosting an event to talk about the work that Project Hope and other organizations are doing. All of that is a humanitarianism, and we really encourage everybody to take action.
Thank you. Thank you both so much for joining me. This has been a great conversation. Thank you both also for all the work that you do. You're both role models and you're very humble, and I love that. Project Hope is committed to humanitarianism, and we hope that you join us in improving the lives of those facing urgent health emergencies. Whatever your passion, talents, you can help improve access to healthcare for everyone around the world. There is plenty of work to do, and we encourage everyone to join our mission, as everyone is a humanitarian. Thank you both. Have a great rest of your day.
Thank you, Meg.
Thank you. Thanks, Meg. Thanks, Rabih.
Thanks, Uche. Bye-bye.